My name's Orla McNally. I'm a gynecological oncologist and head of the gynecology tumour stream for the Parkville precinct, Peter MacCallum, Royal Melbourne Hospital and the Women's. February is Ovarian Cancer Awareness Month, and never was this more important, as we luckily have been able to come out of what has been a significant lockdown, a time during which many women will have had symptoms, possibly due to ovarian cancer, which they may well have not wanted to investigate, being concerned about going outside and seeing a specialist. Ovarian cancer starts within the ovaries. These are small organs within the pelvis, and they have the fallopian tubes closely associated with them. As a result, the symptoms related to ovarian cancer often don't occur until tumours or growths in the ovaries or the tubes become quite big, and often there is already a chance for the cancer to spread to other parts, which is one of the reasons why ovarian cancer can present quite late. But any symptoms that persist over a period of time, for example longer than 2 weeks, really should be investigated by a pelvic ultrasound in the first instance. And the problem with these symptoms is they're often more commonly due to things like diverticulitis, irritable bowel syndrome, but the persistence of them is really what is the key in terms of getting the symptom investigated and persisting with your GP for an investigation. The other common symptom is urinary frequency, again something that is quite common at the age that this cancer usually presents. But if it is not improved, then that is something that should be also investigated. We are now increasingly aware that a lot of ovarian cancers actually start in the fallopian tubes, and this also explains why it can be quite advanced before it is discovered. We're also finding that this cancer can start in the tubes in women particularly who carry a genetic mutation. We know that at least 15% of these cancers actually arise as a result of a genetic mutation, most commonly in the BRCA gene. Many people will be aware that Angelina Jolie was tested positive for a BRCA mutation, and as a result initially had her breasts removed. But what many people don't remember is that it came to light that she had this mutation because her mother actually had ovarian cancer. If we identify women with a BRCA mutation, there is no particular screening for ovarian cancer, unlike breast cancer where you can have a regular mammogram. So with the risk of ovarian cancer, the only way to reduce this risk is actually removing the tubes and ovaries at a time that is suitable for women, particularly not wanting to put them into the menopause too early. There have been significant improvements in the care of women with ovarian cancer, particularly over the last 2 decades. And one of the most important things has been the management by what are called multidisciplinary teams. So this consists of the surgeon, who is the gynecological oncologist, the medical oncologist, radiation oncologist, research team, and the support nurses. We know that if surgery is performed by a specialist gynae-oncologist, then the outcomes for women with ovarian cancer will be much better. And so it is important for any woman being treated with this type of cancer that they do have a specialist gynecological oncologist involved in their care, who will be part of a much bigger team. One of the most important things in our cancer care is research and supporting research in our efforts to reduce not only the incidence of cancer but also death from cancer. During this Ovarian Cancer Awareness Month, it is again very important to know that we have made significant progress in the management of this often lethal cancer because of our efforts in research. As a result, we are now very excitedly beginning to talk about curing even some advanced cases of ovarian cancer, something that we never thought we would be able to say before. This has come about through our efforts in research, and this has mostly been supported by people in the community and raising awareness about this disease, each and every one of us, particularly during Ovarian Cancer Awareness Month, February, even if you're doing Feb Fast, is really, really important. Thank you for watching.